All right, so I got an update here for you guys on Big Pharma doing exactly what Big Pharma does best, and that is price gouging the American people out the ass for pharmaceutical drugs while our government basically does nothing about it. So I got an update here from Common Dreams Jake Johnson, who points out that enough is enough. Outrage as Big Pharma celebrates 2022 by hiking prices on 442 drugs. So let's just go ahead and get into some of the details here, and then I will explain to you guys how absolutely ridiculous the situation is and what can actually be done about it. So he says that patient advocates on Monday condemned the U.S. pharmaceutical industry for ushering in the new year with price hikes on more than 440 medications, a move that came as congressional Democrats' plan to lower prescription drug costs remains stuck due to none other than the corporate ghoul from West Virginia, Joe Manchin, obstructing it, okay? And according to the healthcare firm GoodRx, the prices of 434 brand name drugs and 8 generic medicines were increased by an average of 5.2% and 4.2% respectively, beginning on January 1st, 2022. And the largest hike came courtesy of Pfizer, which raised the price of its anti-inflammatory medication Solu-Cortef by nearly 17%. And the price boost took effect after Pfizer had a massive profitable 2021, thanks in large part to its coronavirus vaccine, which benefited from public funding and the US government developed technology. So this is something that we see pretty much across the entirety of the pharmaceutical industry here in the United States. Is we have these institutions, whether it's like, things like the NIH, the National Institutes of Health, or we just have direct subsidies from the federal government, whether it's working in tandem with the NIH or those direct subsidies. All of these massively profitable big pharma companies, they basically rely on the technology that was helped and largely developed with public funds. And then they take a lot of this technology, they patent it, they privatize it, and then they profit off of it by price gouging the American people and the rest of the world for that technology that, yet again, was primarily or largely developed with public funds and with public institutions like the NIH. So that's the reality of the situation that we have here with our pharmaceutical industry. Our government is basically completely cucked to this industry, and the result of that is pretty glaring. Okay, so we had this report that came out from the Rand Corporation earlier in 2021 that said that prescription drug prices in the United States are 2.56 times those in other countries. Okay, and there's a lot of different reasons for why this happens, primarily because unlike many other OECD nations, the US government does not even have the ability to fucking negotiate drug prices with these companies. So they are basically, again, because they are profitable corporations, and what happens under a capitalist mode of production when there is a profit motive is they are going to try to inflate their profit margins as much as humanly possible. And the way that you do that within a pharmaceutical industry is by ratcheting up your price as arbitrarily and as much as humanly possible. And basically that is limitless in the United States, where our government doesn't have the ability to even tell them, no, you are not allowed to do that. We are not going to pay these completely ridiculous, arbitrarily inflated prices. So again, there's a lot of reasons for this, but primarily one of the biggest reasons is that Medicare doesn't have the ability to negotiate drug prices. And we know that the results of this are absolutely catastrophic. There was one study that came out earlier in 2021 in September that said that in the US, the wealthiest country in the history of the planet, an estimated 18 million can't pay for needed drugs. They also pointed out some other ridiculous statistics in here, like that 1 in 10 Americans roughly basically have to ration their medicines in order to be able to keep up with them. So, this is why the American people have to go up to fucking Canada to get insulin, because it's more affordable there. And it's not as if like there's some market forces that cause it to be more expensive in the US versus Canada. It's just the fact that we are allowing ourselves, our government is allowing us to be price gouged by these same exact corporations who somehow magically allow Canadians to be able to get the same goddamn drugs for significantly cheaper prices. So it's a complete racket, it's a complete scam. And basically the reason for this is because we have this mafia-like industry here in the United States that is able to legally bribe our government. So this is what was happening with the recent Build Back Better plan that is now, again, completely tanked due to people like Kirsten Sinema and Joe Manchin. But the pharmaceutical industry, as pointed out here by the Washington Post, likely to shatter its lobbying record as it works to shape Democrats' spending bills. So listen, if this was happening in any other country around the world, I mean, the United States would be rushing to overthrow their government and say that they were massively corrupt, right? I mean, this is just brazen corruption. We're talking about the profitable big pharma industry that is price gouging the American people, turning around and bribing our politicians to do what is incredibly unpopular and not actually address the policies that are necessary in order to handle this problem. So again, it's just brazen corruption, and it's not just generically, because we know that Republicans and Democrats, both of these parties are completely bought and controlled and beholden to the interests of big pharma, but we can also get more specific with specific politicians that have been massively corrupt throughout this this entire process. One of those was Kirsten Sinema, and I don't know how many times I brought up this specific story, but it doesn't get less egregious the more that I do. Big Pharma and medical firms donated $750,000 to Kirsten Sinema, and then she opposed the drug bill. So they're talking again specifically about Medicare having the ability to negotiate drug prices. Now, we hear these narratives all the time of how Joe Manchin, Kirsten Sinema, they're really just these enlightened centrists, right? They are these so-called moderates within the Democratic Party. Well, they're not moderates, okay? Because 83% of the country, including a majority of Republicans, support having the government negotiate drug prices. Now, Kirsten Sinema doesn't oppose that bill because she's, some principled centrist or something like that. She's doing it because she just took fucking nearly $1 million in bribes from Big Pharma to go and do that, okay? It's pretty obvious. Again, the corruption baked within the U.S. political system is just out there for everybody to see. You don't have to go and dig deep. It's just, this is how our entire political system works here, okay? It's massively corrupt. But we can also get specific with other members of the Democratic Party who are still trying to block the entirety of Build Back Better, including the Medicare negotiating drug prices. But Joe Manchin, let's just check in with his crime family. So Heather Bresch, Joe Manchin's daughter, played a direct part in the EpiPen price inflation scandal. So Joe Manchin, who is currently, again, holding up Build Back Better, including lowering prescription drug prices, he says, we can't afford to do this, right? His own daughter had a direct financial payout of tens of millions of dollars to basically do illegal price fixing on EpiPens, okay? This is just a tiny glimpse into the pharmaceutical industry here, but also, this is a tiny glimpse into our entire political system, because how the fuck could you say that Joe Manchin is operating in any shape or form in good faith throughout the entirety of these negotiations if his own daughter literally made millions and millions of dollars from the same price gouging that he is now opposing, trying to actually tackle as a problem in this country? It's again completely ridiculous. And if Joe Biden actually had any balls to him, he would have gone out months ago, had a closed door meeting with Joe Manchin behind the scenes and said, listen, man, you're going to run this, mafia crime family here. Well, I'm going to need you to fall in line with Build Back Better, right? Maybe the $3.5 trillion bill. I'm going to need you to fall in line with that, or else, I don't know, maybe the Department of Justice opens an investigation into your criminal daughter. Okay, so that's what Joe Biden could have done a long time ago and actually tried to, actually employ and fight for his own agenda and employ some sort of a carrot and a stick approach. But, he obviously was not going to do that because he's an absolute wimp who's letting a handful of corporate members within his own party completely tank his agenda. But, she should be tried for this. This is actual criminal behavior. I know that, Kirsten Sinema, this type of thing should be criminal. It's technically legal because, again, this is just how our political system works. But this is actual criminal behavior that could have been leveraged in order to get Joe Manchin to fall in line. But obviously that didn't happen. And again, this is coming as the overwhelming majority of the country wants the government to negotiate drug prices. So we know the reason why it can't happen. It's not because of enlightened centrists. It's not because of anything like that. It's because our government is completely corrupt. Now, one of the other main narratives that's important to push back on is people will come out, politicians, conservatives, even liberals in many cases will say, well, they have to make these profit margins, right? We have to let them make all of this money and price gouge us basically because they need to invest that in research and development. And if we nationalize Big Pharma, or if we tried to rein in the pricing of these Big Pharma companies and how they are price gouging us, if we tried to rein that in any way, then we would stifle innovation. Well, this is entirely horseshit, okay? In fact, the vast majority, 7 out of 10, of Big Pharma companies during COVID spent more on sales and marketing than research and development. And it's not just sales and marketing. It's also, as we learned from Katie Porter a while back, they also spend more on stock buybacks and dividends for shareholders. So again, all of these narratives blow up when you actually start to look at the data, okay? It's not that these big pharma companies within the US have to price gouge us to spend that money on research and development. It's bullshit. A lot of the technology that actually goes into the patents that they then privatize and price gouge us for, a lot of that technology is developed either through the NIH, the National Institutes of Health, or it's subsidized with public money. So they're not spending this on research and development primarily. They're spending it much more on stock buybacks and dividends. They're also spending it more on things like marketing and sales, as they were just pointing out there. But I mean, listen, the entire reason why this is the case, the entire reason why we are still getting price gouged for these drugs is because motherfuckers like Joe Biden, Joe Manchin, Kirsten Sinema, the rest of the establishment of the Democratic Party, they are largely bought and controlled by the same interests that Republicans are, which is the big pharma lobbyists, the big pharma corporations politicians who dump infinite sums of money into their campaigns to get them to go against the will of the overwhelming majority of the American people. So the lesson in a broader picture, just conceptually, okay, again, when you have markets like a healthcare industry, or when you have markets like a pharmaceutical industry, okay, these are not markets that are elastic, okay? These are inelastic demands. And so you should have a completely nationalized industry when it comes to things like healthcare or when it comes to things like pharmaceuticals, okay? There's absolutely no benefit, especially not on research and development. There's no benefit to having a for-profit corporation, okay? If anything, you could easily make the argument that instead of spending all of this money that they're dumping into stock buybacks and dividends and executive bonuses and sales and marketing, you wouldn't have to dump all that money there, and you could give all of that money, which represents more than the research and development, you could actually put that money towards actual research and development. So there's a great argument to be made that nationalizing these industries would actually increase innovation, and that capitalism and the way that we have our pharmaceutical development industry set up right now is actually stifling innovation, because you're having to divert a large majority of these funds in many cases towards fucking greedy Wall Street executives. So it's just completely ridiculous. All of these arguments fall apart when you actually look closely at them, and the only reason why this type of price gouging is able to happen is because our government on both sides of the aisle has been completely bought and controlled by this industry.